Some of the most devastating injuries imaginable aren't the ones you can see on the surface. They don't always involve obvious open wounds. No, sometimes the worst damage happens deep inside, tearing apart the very connections that hold us together. Today, we're diving into one of the most severe of these hidden injuries, scapulothoracic dissociation.
The medical literature has a pretty shocking way of describing this that really gets right to the point. They call it a traumatic four-quarter amputation with intact skin. Just let that sink in for a second. An amputation, but on the outside, the skin is completely unbroken. How is that even possible? It's a brutal paradox that hints at the unbelievable violence happening beneath the surface.
And here's our first look at the evidence. This X-ray shows the aftermath. See the blue arrow? That's the huge clue. The shoulder blade on the right side of the image has been shoved way out to the side. Just look at that massive gap between it and the spine. The entire shoulder structure has been literally ripped away from the torso.
So what in the world does this idea of a closed amputation actually mean for a patient? How can a limb be both attached to the body and at the same time amputated? Let's break down exactly what's going on here.
The official name is scapulothoracic dissociation. It's a really rare injury that's caused by incredibly high energy. Think a motorcycle crash where the arm is violently yanked. Now, we're not talking about just a broken bone or a dislocated shoulder here. This is the complete, catastrophic failure of the entire connection between the arm and the body.
To really get your head around how bad this is, you have to understand that this injury is a three-pronged attack. Think of your arm as having three critical lifelines connecting it to your body. Well, in scapulothoracic dissociation, all three of them get severed at once.
First, you've got the skeletal lifeline, the bones that give the arm its stability. Second, there's the vascular lifeline, the blood supply that keeps it alive. And third, you have the neurological lifeline, the nerves that tell it what to do. Let's look at how each one of these is completely destroyed.
First up, the bones. The collarbone or clavicle usually just gets shattered. Now here's something you might not realize. Your collarbone is the only solid bony strut connecting your entire arm and shoulder to the rest of your skeleton. So when that shatters, the arm has lost its one and only structural anchor. It basically becomes what surgeons call a floating shoulder.
Okay, lifeline number 2, blood supply. This is an angiogram. Doctors inject dye to see the blood flow and, well, you can see what happens. The dye just stops. That's a complete tear of the subclavian artery, the main highway for blood into the arm. The limb is now completely cut off from oxygen, and the clock is ticking. This is a massive emergency.
And that brings us to the third and final lifeline, the nerves. This all comes down to something called the brachial plexus. Think of it like the master control cable for your arm. It's this incredibly complex bundle of nerves running from your neck all the way down, carrying every single signal for movement and sending every sensation back to your brain. It's the arm's command and control center.
So picture this. You're in a chaotic ER. A patient comes in after a major accident, but their skin is totally intact. How do you even begin to suspect something this catastrophic is going on underneath? Well, you have to know how to read the signs.
The physical exam tells a pretty dramatic story, if you know what to look for. Of course, there's massive swelling and the shoulder just looks wrong, but the real smoking guns are an absent pulse in the arm that points straight to the torn artery and complete paralysis with zero sensation. That tells you the nerves are gone. Put it all together and it screams scapulothoracic dissociation. Now, to confirm it on an X-ray, doctors use a simple but really effective measurement called the scapular index. It's pretty clever. They just measure the distance from the spine to the edge of the shoulder blade on the good side, and then they do the same on the injured side. If the ratio of the injured side to the good side is more than 1.29, it confirms a severe separation.
For instance, in one case from the literature, the scapular index was 1.41. It's just a number, but that number tells a story of an incredible, violent force. It's the objective data that confirms the diagnosis.
Okay, so let's say the emergency team saves the patient's life and they're stabilized. Now comes what might just be the single toughest choice in all of trauma surgery.
The question is as stark as it gets. Do we try to repair this, try to save the arm, or do we amputate? And let me tell you, there is absolutely no easy answer.
It really boils down to two paths, and each one has life-changing consequences. On one hand, you can try to salvage the limb. Surgeons can piece the bones back together, create a stable structure, and protect those delicate vascular repairs. The hope is that the nerves might recover, but the downside is huge. A long, brutal recovery with a very high risk of ending up with a painful, useless arm. On the other hand, there's amputation. For some, it's a faster recovery, and it avoids the burden of a limb that doesn't work. But of course, that comes with its own immense psychological trauma and physical challenges.
When you really boil it all down, this impossible choice almost always hinges on the fate of just one of those three lifelines we talked about. And it's the one that truly decides the patient's future.
And it all comes down to the risk of creating what's known as a flail limb. This is the absolutely devastating outcome where even if you fix the bones and the blood vessels perfectly, the nerves are so damaged that there is zero motor or sensory function left. The muscles waste away and the arm just hangs there, a total dead weight. And get this, the statistics here are just staggering. Up to 94% of these cases involve a severe, often complete, injury to that brachial plexus nerve network. So the nerve damage isn't some rare complication. For this injury, it's practically the main event. And this leads us to the bottom line, summed up perfectly by a major study in the field. The presence of a complete brachial plexus avulsion is predictive of a poor functional outcome. In other words, it doesn't matter if the bones are set perfectly or if the blood is flowing. If the nerves are gone, the function is gone, period.
And if you want to see what that really means, look no further than this X-ray. This was taken 8 months after a successful operation to fix the bones. Look, the plates are holding, the clavicle is healed. Structurally, it looks great. But because the nerves never recovered, there's no muscle function. The arm is paralyzed. And without muscles holding it in the socket, the shoulder has simply dislocated under its own weight. A surgical success, but a functional failure.
And so, this whole devastating injury leaves us with a really profound question, one that cuts to the very heart of medicine. It forces us, and doctors and patients, to ask, when saving a limb means losing its function, what does it truly mean to heal?